We always talk about treatments for the hip, and we start sometimes, some of you may have gone through this already, in non-operative treatment. And some of these may include anti-inflammatories. These may be something like Aleve, ibuprofen products like Motrin or Advil, or probably some of the common first-line defense medications for arthritic pain in the hip. Sometimes we also recommend physical therapy. We know the stronger the muscles are around the hip and the knee, the less force that your hip and knee see. And so by essence, you may not have as much stress on that joint. And so with that in mind, it may allow you to have less force against the hip and less pain. We know one thing that can lead to increased stress across the hip joint and the knee joint is going to be not having an ideal body weight. So what that does, if you think of every pound above our ideal body weight, we know that may increase the force on our hips and our knees. So it's the one thing that we sometimes do recommend. As things progress, and some of you may be using this already, whether it's a cane or a walker or some other form of assistance device, those tend to help decrease, again, the stress reaction around the hip. And so that sometimes can be very helpful. But it's not always something that you want to have the rest of your life. Sometimes can be a burden just getting out of bed. And then lastly, we have hip injections. And these sometimes can be helpful. A lot of times these aren't going to be the permanent solution, whether it's treating arthritis or not. These are a lot of times going to be a temporary fix, if you will, to help relieve or decrease the amount of pain that you have in the hip.